something I want us to leave behind in 2024 is listening to every single person who calls themselves a healthcare provider on the internet without actually confirming that they are a healthcare professional. I don't know if that makes sense. But I think that we need to start doing our due diligence because there's so many opinions out there. Many people calling themselves specialists, many people saying I'm this, I'm that. But please go the extra mile and actually confirm, is there credibility to this? Hi guys, welcome to my channel. I'm joking. Yes, it's me. It's Dr. Hope, and this is a new podcast. And wait. I know there's so many podcasts out there, but this is a different spin. This is A Dose of Health, the podcast. So karibu sana, and here we'll be having conversations that need a bit more time and maybe a bit more intentionality, but Instagram will still be a place where we interact. So feel welcome, feel at home, get yourself a cup of tea. Please look at my cup. Please look at my cup. So let me tell you the backstory around this cup. This was a gift for my birthday earlier this year by some friends of mine. And little did I know I would be using it this soon. So this is our prop. And you will be seeing it over and over again. So welcome to the A Dose of Health podcast. Okay. So I know you might be wondering, why am I in scrubs? I decided to wear scrubs because this is the one time you will see me in scrubs. I'm wearing this for believability. So that you can believe I am a medical doctor. I actually am licensed in Kenya. I am a general practitioner, but more importantly, I'm a health advocate, health communicator, and a serial yapper. So here we'll be talking about health. So we'll be demystifying health and other health concerns that you may have. But at the end of the day, I just want you to remember that I am here for a healthier you. And on A Dose of Health, I give you not too much, not too little, but just enough health information to make you make an informed decision around your health. Okay. So I know I said we'll be tackling some complicated topics, but to start it off, I want us to start lightly, just lightly so that, you can warm up to it. So this is a new year. Happy New Year. In fact, did I mention Happy New Year? And in 2025, I have some things on my phone here. I decided we need to be tackling things we are leaving behind in 2024, but the health edition. Sawa. Okay. Before we get there, I have this segment where I'll be talking about a journey to Inside Out. So if you've watched the movie Inside Out, it's a movie about emotions. So getting in touch with your emotions. And I'll be taking my guests through this segment and myself as well, where I'll be getting to ask them, where are you emotionally as we're speaking currently? So for me, if I'm to answer that question today, I would say I am proud, one, because this is me doing it in fear. I'm doing it scared, I'm doing it afraid, but I'm proud, that's one. And then number two, I'm excited. I really love talking. If you can't already tell, like if I do a word count now, I think I've already passed 1,000. But I really love talking, and I'm so excited to keep talking and keep educating new people and myself as well about health and health topics, life and just lifestyle, etc. But primarily health. So those would be my emotions for the day. Okay. So I had this conversation with a friend of mine when I was telling her about the podcast and what I'm thinking about. And she gave me a very good idea that I'm going to incorporate. In fact, I've stolen it. I might trademark it in the future. But she mentioned that there are certain things that me, as healthcare providers, we consider to be normal. But then to you guys, it's medical jargon. So I decided I'll be having, before the episode starts properly, I'll be taking you through medical jargon. So I'll just explain one thing. And the one thing that they wanted to know about was prescriptions. So now her brother was asking, now when you guys write prescriptions and you write 1 times 3, 1 times 2, what does that mean? Worry not. We are here to solve that issue. So let me break it down for you. 1 times 3, 1 times 1, 1 times 2. What does that mean? So the first one is the amount of whatever it is you're taking. If they're pills, if it's teaspoons of a certain syrup, etc. That's the first one. So let's assume we're using 1 tablet of a medication. So it's 1 times 2. So the second 2 is the frequency of how you're supposed to be taking this medicine in a day. So if it's 1 times 2, your day has 24 hours. So 24 divided by 2 is 12. This means that you'll take this medication, 1 tablet, twice a day. So after every 12 hours. And the same applies for 3. If it's 3, you do 24 divided by 3. That gives you 8. So you'll be taking it every 8 hourly or 3 times a day. If it's 4, every 6 hourly or 4 times a day. Basically, that's it. So I hope we're on the same page. But please, if you don't understand, don't be shy to ask your doctor. Number one, before you leave that room, ask your doctor. If you didn't ask your doctor, don't be shy to ask the pharmacist. We're here to answer all the questions and to explain to you what you need to understand so that next time you're making the informed decision. And also at home, you're taking the medication as prescribed, not the way you feel. And let me just remind you, antibiotics, you finish that course. Finish the dose. Yeah, if you have a moxil now and you're supposed to finish it, even if you're feeling okay, finish it. Yeah, I'm talking to you. Okay, so now let's just get started. So things we're leaving behind in 2024 Health Edition. Many of them will be myths and misconceptions that I will be debunking. And the first one, please don't take offense. Please don't take offense. I'm just telling you the things how they are. Number one, detox tea, weight loss tea. Can this be the last time we hear about those things? Let me just start by saying, one, there's nothing like a detox tea. If you're taking a detox tea, your liver is looking at you like, am I a joke to you? Because the main function of your liver is to detoxify anything that needs to be broken down into a useful form or into waste. And once it's waste, it then goes to the kidney. So your liver is actually all you need for detoxification. You don't need the tea, you don't need the smoothie or whatever it is. You can have them as add-ons, especially the smoothies, but you don't need them. So that's number one about detoxification or detox teas. Then number two, weight loss teas. I don't know where this one came from, but what those things have is basically they act like laxatives. A laxative is, it's something that will enable you to just ingest and release it through the same path. You won't be digesting your food, and that's exactly how they work. So you're not really digesting the food that you're eating. It's just entry, exit. So that's basically the weight loss teas that you're consuming. So those things, we're leaving them behind in 2024. And then there's this other one I saw on Instagram. And I think, let me ask the people in the room, have you guys ever heard about slimming wires? Slimming wires. Yeah. I think we'll need to put like a video here. So basically, I saw them the other day as on TikTok. Slimming wires, they're like braces that keep your mouth shut. Yes, they keep your mouth shut so that they control how much you're eating, what you're eating, and they're used for weight loss. Yeah. So the issue with slimming wires is, one, they are so dangerous. Like, I don't think we think about any emergency happening. If an emergency happens, we need your airway. We need to access your airway, which means we need your mouth to be opened. So in the case of an emergency, slimming wires are like so dangerous because you can literally just suffocate because we can't have access to your airway. That's the first thing about it. Then the second thing, and this was coming from a dentist, is a dentist who was speaking about this. If you have slimming wires, how are you brushing your teeth? What's your oral hygiene like? And the dentist actually said, yeah, you might actually lose weight, but at the same time, you might also lose teeth. So you pick a struggle. So slimming wires, weight loss teas, what was the other one? Detox teas. We can all agree that is 2024. All right? Yeah, you guys don't say I didn't teach you anything. Slimming wires. 2 years old. Then the next one, I really like this one. The next one is, for you to have good skincare products, they have to be expensive. Guys, let me tell you, expensive skincare products have enough money to market themselves. That's one of the ways they really get us. I am a victim. I'm a victim as well. But just because something is expensive doesn't mean it's the best product in the market. When it comes to skincare, there's so many things you need to consider. What is your skin type? What are your skincare concerns? These are some things that you need to be thinking about before you actually consider, I need this product. And then the other thing is, I don't think we're looking at active ingredients. We need to look at the active ingredients of these skincare products. So active ingredients are things like, the salicylic acids, your BHAs, AHAs, your retinols. We need to look at those active ingredients. Do you need those active ingredients to be on your skin? I'm waiting for you to answer. You don't need those active ingredients, or you might need them. So please look at the ingredients. And then lastly, the most important thing, and I advise this to everyone who wants to start their skincare journey, I would say just once, just have a consultation with a dermatologist or a skincare expert. Just once. so that you can get to understand your skin. And then from there, you can now make decisions based on understanding what your skin type is and what your needs are. It will save you a lot of money. Let me tell you, the consumerism that's in skincare today, these people are making so much money. And I'm not saying their products are not good products. They are good products and they're necessary for certain skincare needs. But the question is, do you need that product you've just gotten? Think about it. And we'll be discussing consumerism in this season, actually, in the next few episodes, because for me, that's something that's very important. And I need you to understand that before you think of getting radiant skin, or what's this other skin type people keep talking about, glass skin, before you think of whatever, think of healthy skin first. Because if you don't have healthy skin, there's absolutely no way you'll achieve all these other skincare aesthetics, let me call them aesthetics, that we're all working towards. So healthy skin first, and then you can add on the rest. But remember, please see a dermatologist, an esthetician, at least a skincare expert. Okay. Next, and this one I will shout. I have shouted, I have been shouting, I will keep shouting. Antibiotics. Antibiotics, please tell me the rules. I want to shout, the audience. I have an audience. I want you to shout, what are the rules of antibiotics? Don't finish the... Get out. Just get out. Don't finish the dose. Share with your neighbor. Don't take it at the time. No. Please don't listen to these people. Number one, you must complete your dose, you guys. If you are on antibiotics, you must complete your dose. That's number one. Number two, actually, that's number two. Number one should be antibiotics are only gotten on prescription, because antibiotics treat bacterial infections. So the only way for you to know that you have a bacterial infection is by getting tested. And I'm sure at this point you know that you can't write yourself a prescription. So you have to get tested, go see your doctor. Please make sure you're tested, and then they will prescribe for you some antibiotics that you need to be on if that's the case. Once they've prescribed the antibiotics, now we start the process. One, complete the dose. Even if you're feeling better, you were coughing, you had congestion, now it's gone. It's okay. The bacteria is still doing this. It's just like, yeah, come. So just finish the dose. That's the first thing. Then number two, don't share your antibiotics, please, because different antibiotics are meant to treat different infections. Yeah, it's true. I know you didn't think that, but yes, it's true. So UTIs, urinary tract infections, are treated by a certain type of antibiotic. Upper respiratory tract infections are treated by a different type of antibiotic, and the list goes on. So please don't share your antibiotics. And then the last one that I'll talk about is now around hygiene. So if you know me, you know there's one thing I keep saying. The first way to prevent yourself from getting infections is hygiene. So please wash your hands, wipe your hands, shower, clean yourself properly. And please, when you're leaving the bathroom, men included, wash your hands. Please wash your hands after using the bathroom. Okay? Thank you. I think hata tunaweza end the video here, because once I've passed that message, I think I'm done. But we will not. So antibiotics, please, we don't want to be building superbugs. And superbugs, okay, what happens is you'll get antimicrobial resistance. So the resistance is not to your body, it is to the bacteria. So anytime you'll be taking this antibiotics, the bacteria will not be responding to the antibiotics. It's not your body becoming resistant to the medication. It's the bacteria which are supposed to be killed and incapacitated by these antibiotics. It's not working on them. So them, they're just going about their day, living their lives, in fact, living their best lives, because now you've given them tolerance. They're building a tolerance against now these antibiotics. So that's how we build antimicrobial resistance. And remember, we don't have so many antibiotics. So if we misuse them, then at the end of the day, we'll all be not a cold. When you get a small bacterial infection, you'll be using the strongest antibiotic just because we've abused all the others. So things like amoxicillin, things like azithromycin. And let me tell you, the one thing that COVID did, COVID enabled us to misuse azithromycin. These days, it's like munazimeza kama sweets. Ni kama ni peremende. No, guys. In fact, I think that's azithromycin and amoxicillin are some of the antibiotics that in the next few years, will be as good as useless because we're really, really misusing them. So that's it about antibiotics. Okay. Moving on next. Let me check. I had like a list over here, like a serious list. This one. And please listen up. Yeah, bring your ear like this. Listen up. Supplements are not a substitute for food. You do not need supplements every single day of your life. If you're eating your food, you're eating a balanced diet, which is where your nutrients, vitamins, and nutrients come from. You do not need supplements. Now, don't get me wrong. There are people who need supplements because supplements are supposed to sort out a deficiency. Okay. So these people are, for example, pregnant ladies because they need supplementation of iron and folic acid. So they're normally on IFAS. Yeah, so in case you didn't know what IFAS is, it's just iron and folic acid supplements because they need the baby to develop well. If they're not on these supplements, then it'll affect their pregnancy and the development of the child. Other people who may need to be on supplementation are menopausal women because they have a drop in estrogen, and estrogen is what essentially enables them to have like stronger bones. So they need calcium supplements, sometimes vitamin D supplements, because they're at risk of getting fractures. Any small fall, they're at risk of getting fractures. And the same can apply for like elderly men as well. And then another special group is babies. So children who are born prematurely, especially, they need to be on, a good number of them will need to be on iron, they'll need to be on folic acid, and they'll need to be on, what's the other one? On vitamin D. So these are people who actually need to be on supplements. But then now you're here, you're capable of eating a balanced diet. There is nothing that is limiting you. Your mouth is functioning well. You have the resources. You have the food available to you, but you want to add supplements. No. Eat your food first. And then if you need to supplement, then you can build on that. And also remember, sometimes you might think you're deficient, but you need to have a test done. So for things like vitamin D, your calcium, your folic acid, B12, you can have this test done to just detect how low is this vitamin or this particular nutrient, and do you need to supplement. So these are available to you. Oh, and then there's a group I forgot, and this group includes, I think, many of us, adults, children. Did you know many of us are vitamin D deficient today? Did you know? Do you guys want to guess why? Yeah, we don't go outside as much. So we all work in high-rise buildings. People don't sit by the window. Even kids now, many of us live in apartments. Children don't go outside to play in the sun. So you find that many kids were getting rickets. And also us as adults, we have vitamin D deficiency. And I know you're thinking, okay, fine, I need vitamin D supplementation. I need to buy them. Wait, the sun. The one outside, the sun, it is the best source of vitamin D. So you can start there. If that is not enough, then you can supplement with now actual vitamin D that you ingest. And sometimes we abuse these things because like for people who live in areas where there's actually winter, they don't get sunlight. And for them, they get vitamin D deficiency seriously. And they need to be on supplementation because the sun is not coming out anytime soon. But for you who actually has the sun, please just go outside. You just need a minimum of 20 to 30 minutes in a day. So you can scatter that. Go outside for 10 minutes. Then after a few more hours, go outside for another 10 minutes. In the evening, go outside for 10 minutes. You've gotten your 30 minutes. And that's all you need. At the same time, remember SPF. Apply your SPF. Very important. Okay. Let me see what I have next. In 2025, please let's not talk about wearing uncomfortable shoes. In fact, I think orthopedic surgeons and podiatrists need to just come and tell us how we need a very good everyday shoe. And an everyday shoe is a shoe that you can wear the whole day comfortably. This everyday shoe should be, it should have a cushion. It should have a cushion. And I know many of us, especially women, I'm speaking to the women, we've been told that flat shoes are the best shoes for an everyday shoe. That is actually not the truth. A flat shoe doesn't have cushion. And if a shoe doesn't have cushion, there are two things it's not offering you. Number one is ankle support. And then number two is arch support. Now, for most of us, we have an arch. Your foot has an arch, unless you're flat-footed, which the arch has been obscured. But for most of us, we have an arch. And for you to be able to have stability of your foot, you need the arch to be preserved and you need ankle support. So a shoe with cushion is going to give you both of those things. If you don't wear a shoe with proper cushion or one that doesn't give you proper ankle support and arch support, you'll be complaining about two main things. Number one, your foot hurts. Number two, your back. And this translates to your posture. I said posture and someone just sat up. Many of us complain about posture, myself included, and one way to work around that is the shoes that you wear. Let me tell you, for us as doctors, the one thing that I think we suffered from was ward rounds. A ward round, you'll be standing for 3 to 4 hours continuously. And if you're not wearing a good shoe, at the end of those 3 to 4 hours, you'll be finished. And that's why today, if there's one thing I don't do, is I don't stand. I don't like standing. I do not like standing. No, 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 no. Anywhere I am, I need a chair nearby. Just nearby so that I can just rest. Because a good shoe is very necessary. It'll spoil your back, it'll injure your foot, and it'll affect your posture. So please, in 2025, invest in a good shoe. And a good shoe can be a good sneaker. That's why when people start running, they start investing. Because first of all, do you know how running is an expensive sport? It's an expensive habit. Because the first thing, you'll invest in shoes. And running shoes, they're not cheap. But the thing is, once you invest in a good running shoe, it can become a good walking shoe and a good everyday shoe. So invest in good shoes, a comfortable shoe that will offer you ankle support and arch support. It'll improve your posture, it'll improve your backache, and it won't affect your feet. Sawa sawa. Now, the next one is something that is very dear to my heart. Dear to my heart. If you know me, you know the one thing I love to do is sleep. You can pay me to sleep. In fact, my dream job is testing mattresses. And not the active phase. No, give me the passive one. I want to just sleep on the mattress. I'll tell you if it's comfortable. I'll tell you it's soft enough. I'll tell you it's too hard. That is my dream job. I just want to be testing mattresses out. And then we can tag team. Someone can do the active phase and then I'm just there sleeping the passive phase. So sleep is so important. And I think we really underestimate the power of sleep. Sleep is so good for, one, your mental health. It's so good for your mental health and it improves your concentration. You'll find that if you sleep well, you're less irritable. And I'm sure everyone has noticed that. If you don't sleep well, you'll be so grumpy, so irritable the next day, you can't concentrate. Yeah, because you're sleep deficient. You have been deprived of sleep. Another thing is it's very good for your immune system. So it builds your immunity. So if you're not sleeping well, you'll notice that there's so many people who actually, you're constantly getting a flu, you're constantly getting a stomachache, or you're just constantly sickly. Sleep is something that can actually improve that because it strengthens your immunity. Then number 3, sleep is actually important for, I have to say it, for weight management. Now mark my words. I didn't say weight gain. I didn't say weight loss. I said weight management. Sleep is very good for you because when you're sleeping, there are certain bodily functions that actually take part during the passive phase of your body functions. And if you're not sleeping well, then those activities can't happen effectively. So that's number 3. Then number 4, sleep is actually good for your physical health, for your body. So you won't be feeling tired. You'll be feeling energized. You'll be feeling like, yes, I can actually face the day. So I want us to actually make sleep a priority. And I know many of us will be like, but I get, is that a monkey? Sorry, but many of us will be saying that, I get 6 hours of sleep, I get 12 hours of sleep, but I still wake up feeling tired. But the question is that good quality sleep? So good quality sleep means that when you wake up the next day or after that sleep cycle, you're feeling energized, you feel well rested. And there are certain things you can do to improve that. And that's sleep hygiene. I think we'll have to talk about this later, but let me just give you some things to improve your sleep hygiene. Number 1, this thing. Even for me, if your phone is putting you to sleep, it's not helping you. Your phone, your laptop, your TV, it's not helping you. And I know we're all struggling because we're all human beings. Yes, even doctors are human beings. The same things you guys go through are the same things we go through. So your phone, your laptop, your TV, it should not be putting you to sleep because what happens is you're stimulating your brain while it's supposed to be going to sleep. So, of course, you'll keep being awake, keep being alert. So, number 1, your gadgets. Give yourself like at least 30 minutes or 20 to 30 minutes before you sleep, turn off the TV, turn off whatever you need to turn off, and just rest. Like, just be there. That's number one. Number two, eating. So you should have your last meal about an hour or two before you get to sleep so that it can start digesting, because you'll be uncomfortable. So you don't want to be so full before you go to sleep. In fact, what we advise is your 3 meals in a day. The heaviest meal should be breakfast. So breakfast should be the heaviest meal in a day, followed by lunch. Lunch is neither here nor there. So some people can survive without lunch, but then the lightest meal of the day should be dinner. I know we normally work backwards. Dinner is usually the heaviest meal of the day, but you'll find that if you stagger your meals like that, the heaviest one being breakfast, and then lunch is light, and then dinner is the lightest, you'll actually get to sleep better. So that's number. I forgot, but we move. Then the next one is physical activity. I think this one is tested and proven. If you're active during the day, you'll sleep so much better. And many people say that they prefer to gym in the evening or to work out in the evening because it makes them sleep better. For me, that's not my ministry. I'd rather work out in the morning. But just being active, at least a minimum of 20 to 30 minutes during the day, will improve your sleep. So be active. And then let me make this the last one in relation to sleep hygiene. Drinking alcohol, that is, stimulants like coffee, and just substances that stimulate your body are not good for you, especially if you're trying to go to sleep. So coffee will make your mind very active. It's a stimulant. And then alcohol as well will affect your sleeping pattern. So what alcohol does is it doesn't enable you to go through the sleep cycle properly. So you'll find that you keep sleeping, but you wake up. You sleep for like 30 minutes, 2 hours, you wake up. Another 30 minutes, 2 hours, you wake up. And then what happens at the end of that, when the hangover is finished, now you sleep for such a long period of time. So it affects the sleep cycle, the REM and non-REM sleep, how it's supposed to happen. So I'm not saying that you don't drink. You can indulge here and there, but don't make it an everyday thing, because if you make it an everyday thing, what will happen is your sleep will become affected. And the same for coffee, especially for people who are, and some of you are so addicted to coffee. Like it's a problem. I can't start the day without coffee. Guys, imagine you can. You can survive without the coffee. I'm not saying you don't, but you're not, please don't make it an addiction. Okay, yeah, like calm down, rest. But yes, things like coffee can actually affect your sleeping cycle. So if you feel that you need to have coffee and it literally wakes you up, and maybe like you're not sleeping well, I would suggest that don't have it in the afternoon, because it can keep you stimulated for quite a long period of time, and it'll be hard for you to actually induce sleep. So sleep hygiene ni muhimu sana. Okay, then I'll make this the last one. In this day of social media, where there are people like myself and many other healthcare professionals on the internet, something I want us to leave behind in 2024 is listening to every single person who calls themselves a healthcare provider on the internet without actually confirming that they are a healthcare professional. I don't know if that makes sense. But I think that we need to start doing our due diligence, because there's so many opinions out there. Many people calling themselves specialists, many people saying, I'm this, I'm that. But please go the extra mile and actually confirm, is there credibility to this? Are they actually a doctor? And I'll make it easy for us, especially doctors in Kenya. I'm not so sure about nurses and clinical officers and the rest, but for us doctors in Kenya, it's so simple. You can actually get our name. Like for me, you can get my name, go to KMPDC, go to the website. They have a place where you can actually confirm if said person is a registered and licensed medical professional, medical doctor for that. And you can confirm their specialty, you can confirm, I don't know if you can confirm where they work. I don't think they give all that information, but you can confirm their specialty, if they're licensed, and if they're a credible doctor. Even their number is there, the registration number. So please, 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 please take the time to just go and confirm. For me, I'll confirm for you already. I'm registered, I'm licensed, but you can also do the due diligence for yourself. But please take that time to actually confirm that you're getting information from healthcare providers and that it's credible information. And then also, many healthcare providers will tell you what I'm saying is not a consultation. You still need to go and see the doctor. Because remember, at the end of the day, for us in med school, we are taught a proper consultation involves taking a history. That's getting to hear What are your symptoms? When did they start? How long have you had them? What medication are you on? etc. And it's not complete without a physical examination. A physical examination means I touch, I examine, I listen to your chest, I listen to your stomach. If you're expectant, I examine your belly, etc. So I really need to examine you before I make an actual diagnosis. And sometimes, yes, the history is 80%, and the history will include the physical examination. Then we go to the next things, investigations, where your blood is taken, a sample is taken, maybe a urine sample, etc., and imaging. So that is the entirety of a medical consultation. And I can't do that on social media. And I know many of us tend to ask, hi, doc, I'm feeling this. I've been having this. What do you think it is? And I think for me, myself, I make it very clear that, okay, fine, it sounds like this, but please, I'll advise you to go and see a medical professional so that they can do a comprehensive consultation, including physical examination and any relevant investigations that need to be done at that point. It's very important, and that's how you reduce misdiagnosis and certain errors that can actually be bad for you. So, what I would say is take the information. You can cross check the information on the internet. The internet is open today. By the way, anything you need to find, you'll find it. If someone is talking about, oh, there was a new study that was done, you can Google that study. If someone talks about, like now there's a craze that's happening, and I forgot to mention this one. Oh, for weight loss. Have you guys heard of coffee enemas? Yes, so there's something called a coffee enema. So an enema is something we use to clear your colon or cleanse your colon before a certain procedure. So it can be what is the common? A colonoscopy is like one of the most common procedures. So you're given an enema to remove anything that can be in there because you want to inspect the colon. And if there's poop in there, then you're not going to see entirely. So that's what we call an enema. So it'll clear your colon. But now people are doing enemas as a form of detox to get rid of toxins. Guys, come on. No. You don't need it. You don't. I know it's an ancient practice. It's been there for over 1,000 years. But imagine you don't really need it. Anything that is stuck, or rather that is in your colon, rectum, will indeed come out. If it doesn't come out, that is when you need the assistance. The toxins that you're trying to remove, unless you tell us which toxins those are, but they're not toxins you're trying to remove, they will come out eventually. You don't need that coffee enema. But if you're going to do it, and we say this for almost everything, including cosmetic procedures, please make sure it's a licensed professional. Because at the end of the day, you don't want to have botched procedures. So please make sure you're getting all your healthcare needs from licensed practitioners in whatever field it is. Mental health, what else? Physical health. It can be physiotherapy. It can be nutrition. Licensed professionals, please. Okay? Sawa. So I think that's what I had for today. But remember, guys, these are just some myths and misconceptions that we've been hearing around health. And I think social media has a big role to play because you hear most of these things from social media. So as much as there's a lot of misinformation out there, some of us are still fighting. We are still fighting here to try and give you the right information, credible information that will be useful for you. So I hope you've learned something. I hope you'll pick a thing or two, and you won't pick everything. If you're picking everything, you know you're lying. So pick a thing or two, and let's move into 2025 with that information. So that's it for the first episode of A Dose of Health. We'll be having more similar conversations. Some of them will be serious, but if you know me, you know I don't take myself too seriously. So I'll try to maintain the same light energy. But at the end of the day, I just want you guys to learn more about health, to learn more about yourselves, and to make informed decision. An informed decision means you're saying yes or you're saying no based on what you know. So I want to create empowered patients, that's me and you, and not patients who let health happen around them or to them. By the time you're saying yes, by the time you're saying no, I want you to know what you're saying yes to and what you're saying no to. So karibu sana, please like, please share, please subscribe, and share this with someone who you think would benefit from this. Bye.